Hi, welcome back. My name is Nicole Cavender with Aero Benefits Consulting, and today we're going to continue on our series, but we're going to get a little more in depth about looking at your documents that you've pulled together and identifying those important details that you need to know to make a good decision. So the first thing that I would ask you to pull apart and look at is to determine what network are you required to use on the documents in front of you. Sometimes it's super simple and you'll see the word either HMO, POS, PPO. If those aren't readily and easily identifiable, then you may need some additional assistance and might want to reach out and confirm what doctors you're going to have to use. This can often make a big difference in price. So looking at these documents and making sure you understand what you're seeing is the first step. Identifying the out-of-pocket maximum is going to be the next step. Now, out-of-pocket maximums can be tricky because many times you'll see a plan that has a very large out-of-pocket maximum on it. But when you start looking at those plan details really closely, you never seem to hit that deductible. You're never going to be required that out-of-pocket maximum because you're never required to spend any real significant spending. While that out-of-pocket maximum is high, you may or may not have a chance of ever meeting it, which is a good thing. It means that there's a lot of co-pays on the plan. Identifying how you're going to reach that out-of-pocket maximum is of utmost importance. One of the ways that you will quickly get to your out-of-pocket maximum is through the use of co-insurance and the deductibles on the plans. So it's important to now keep looking down through that plan design and identify, am I going to be on the hook for a certain percentage of my hospital stay? That's usually where you'll see a co-insurance hiding if it's not glaringly obvious somewhere else. Definitely taking a minute to look for those co-insurance and deductible amounts and how that's really going to get to that out-of-pocket maximum is important. The other item that is going to be of value to you in some cases to identify is whether or not the plan is eligible for some sort of tax savings plan. So this could be something like a flexible spending account, a health reimbursement account, or a health savings account. Oftentimes these are little key indicators that'll tell you whether or not a deductible is first or not. So these are all things that I would ask you to reach out if you have additional questions on. These are just high-level overviews to help you identify some of those key pieces within your comparison materials. You should be asking yourself things like, what did you like or dislike about your coverage this year? What kind of network changes or cost-sharing changes have there been on the plans that you're looking at? Are you now required to pay more or have a larger out-of-pocket exposure? Or do you have to use a reduced network? Maybe you don't have the same access that you had last year. It's important to look at all of the changes that may have occurred through the plan updates and the renewals. Last, I would say look and see if you have any availability to purchase, whether it be through your employer or even on your own, some of those tools that we talked about in some of our previous series pieces. Things like accident, critical illness, group hospital indemnity, or a hospital indemnity program. These are tools that you can purchase on your own that help bridge the gap when you're trying to meet some of those higher out-of-pocket maximums.